Concierge PT. I'm here today with Dr. Snell here
Hello.
in Chattanooga. She is our new breast surgeon here in town. We're very excited to have her. So I'm talking to her today about some of those common questions that get asked that sometimes when you get the cancer diagnosis you may forget or ask again or anything like that. So you can have this video to reference back and kind of know the answer to what she may answer or what some of those kind of guidelines are that most surgeons will follow. Not everyone, but most. So one question she says she gets asked all the time is, what about getting blood draws, IVs, blood pressure on that affected side?
So the lymph node surgery has changed a lot for breast cancer in about the last 15 years. We used to quote unquote remove them all. That was called an axillary node dissection. And over the last 15 years, it's been shown that maybe less lymph node surgery is better. And that's called sentinel node biopsy, where we just remove one or two to check the nodes the breast drains to first. So number one, that decreases your risk of having significant arm swelling. However, things that Americans now are using more commonly increase your risk, aka obesity and radiation after breast surgery, which is becoming more common in the setting of lymph node positivity. So what do we say? Well, I specifically say for complete dissections, if you can avoid using that arm for anything that's going to puncture the skin, i.e. blood draws, i.e. IV access, but particularly long-term IV access, just try to avoid that arm because it's anything that can get infected just doesn't clear as well. Especially if you already have baseline arm swelling. So we want to avoid that arm. In the setting of sentinel node, the common mantra is you can use it for whatever you want. However, if you do notice that you have a small amount of arm swelling just with the gatekeeper nodes alone, then I would try to use the other arm. Blood pressure itself, probably never a problem because it's not going to break the skin. Your job is to avoid infection by skin being broken. But that also applies at home. If you're working in the yard, if you're cutting up chicken in the kitchen, then put on some gloves.
Play with your cats and dogs?
Yes, put on some gloves because we just want you to avoid infection in any arm that has had lymphatic surgery.
Yep, absolutely. And once you affect that lymphatic system, that's part of your immune system, you're at risk for infection. Anything that pierces your skin can get infection.
I do notice that patients are very concerned about it in the setting of the healthcare field. But in actuality, their risk is actually probably more at home.
Yes.
Right? Because we're going to clean it with alcohol.
Mm-hmm.
We're going to make sure your skin's clean before we do anything to you.
Mm-hmm.
At home, they're not. So we always instruct patients post-lymph node surgery to wear gloves when they're doing those sort of things.
Absolutely. Absolutely. Thank you. And I try to teach my patients that, and so many have told me, I never heard that. Well, did they not hear? Did they not remember? I don't know.
They give you a handout that says it.
Yes, because there's a lot of information thrown at you when you get that diagnosis.
It's too much.
Yeah. The other thing that she gets asked about is, do I need a sleeve to fly?
The answer is we don't know. the data says you don't need a sleeve to fly. However, I've had a few patients who have flown and then developed arm swelling. So if you're able and or your insurance covers one and you're going to be on a flight, there's no downside to buying it.
Yeah.
So I encourage patients to get it, and I'm happy to write a script for it if they can get it.
And there is more research coming out, really excited about it, that they're finding more ways to find subclinical lymphedema,
Yes.
so before you start to show signs and symptoms, and those patients benefit from getting sleep to stop and prevent.
It, yes.
And so that's fantastic news, and we're gonna get closer to an answer, other than just maybe.
Paper last week, right? 2 weeks ago.
Yep.
Came out. I saw about preventive sleeve wearing versus
Yes.
Saw it.
And so a lot of the times if you've had surgery and all of this other stuff, you've met your deductible, a lot of insurances will help with the cost of sleeves. Even out of pocket, getting one as a preventative may be worth it, depending on your risk level.
And make sure you have the right measurements when you get the sleeve, not just you get a sleeve, because that can actually turn into a tourniquet effect and make your hand swell more than you were really helping your arm.
Absolutely. We've seen so many people with socks with that example. Is,
yes.
Oh, my legs swell when I stand all day long. They get the wrong sock and then they swell up more.
Yes.
Same thing can happen in the arm.
Yes.
Talk to someone who knows about the sleeves to get the right measurements.
Correct.
Another thing I wanted to talk about was what type of testing and imaging kind of goes into diagnosis and treatment plans.
So for breast cancer, what usually happens is you go when you get your screening mammogram, you're not having a problem, right? That's the point of mammogram, is to find it before you feel it. And they call you back, and then you get additional mammogram and often an ultrasound. Usually ultrasound is used to do the biopsy. Find it on ultrasound, take a little numbing medicine and take little pieces of it.
Mm-hmm.
Then after that, then the whirlwind starts, right? Like you get called and you're like, oh my God, I have cancer. What do I do next? So typically you come back in and see the surgeon and we go over different options and your treatment plan based on which subtype you have. And then you see a medical oncologist and a radiation oncologist because they are often in this treatment plan, depending on your age and the size of cancer and the best surgery plan for you. Sometimes you need to see a genetic specialist and sometimes you need to see a plastic surgeon. So we get all those set up for you. You go see them and you come back. As far as real testing, blood work has never been shown to be beneficial to check for spread for breast cancer. So we don't normally order that until you go to pre-op to make sure you're healthy enough to have anesthesia, and or you're going to chemotherapy first to make sure your liver and kidneys can get rid of the toxins that chemo gives you so you stay well.
Yeah.
Particularly for other cancers, there's these tumor markers you can check. Okay. Like in colon cancer, there's CEA, and in pancreatic cancer, there's CA19-9. There's no real breast cancer tumor marker unless you've already had metastatic disease beyond the breast and the nodes. So we don't check for that either. The one thing we can order is a breast MRI. Particularly if you have dense breasts or a strong family history, we get that imaging to make sure this cancer is really the size we think it is, and or there's not a second area in the other breast or that breast that would be a better candidate for mastectomy. Okay. And then we can get a PET scan or a CT bone scan looking for spread beyond the breast if you have lymph node involvement and or your cancer's over 5 centimeters. Those are what's called NCCN guidelines. So if you meet the criteria for those tests, we order it. Yeah. But if you have a small breast cancer that is pretty well behaved, you're going to come in and not really get much additional testing, and that's okay. That's normal.
I've heard people and seen people on message boards of, why didn't they check this? And
why didn't I get a CT scan?
Yes.
Never been shown to be beneficial, and just costs more.
Yeah, and you're exposed to other elements and all that stuff. So they are following research guidelines and stuff like that. But if you ever have a question about it, ask your doctors.
Yeah, just ask.
Do this day in, day out. So sometimes it's just habit, and you gotta ask them the question.
Yep, that's true.
I do it myself with some things. It just happens. But that was kind of what I wanted to talk to you about. Is there anything you like to tell your patients, or anything, just last words of wisdom or anything like that?
I think the thing about breast cancer is it's super scary because everybody knows somebody with breast cancer. But if you think about that, that should make it less scary because you know people have had it and done very well. Mm-hmm. And I think that's the important thing to breast cancer people should know is you're going to do very well.
Yeah, I have 5 family members alone.
Yeah.
And they all are surviving.
Yep. And so that's really at the end of the day about breast cancer is it's scary, but you're going to do very well. And we're going to get you through it.
Yeah. And they have a team to help out.
Yeah.
And always here to answer questions. Yeah. All right, y'all. Thank you so much.
You're welcome. Thanks for having me.